Thank you very much, and thank you all for making it out here bright and early on a Saturday morning. So I'm going to talk a little bit about alternative therapies for glaucoma. So, first of all, what exactly defines complementary and alternative therapy? Well, the American Medical Association defines complementary and alternative therapy as treatment and healthcare practices that are not widely taught in medical schools and are generally not used in the hospital setting. So why is it important? Well, when they actually surveyed people across the board amongst the different specialties, they found that in America, approximately 42% of patients have reported some use of complementary and alternative therapy. This is probably an underestimation because, once again, this is something that was self-reported, and there's a lot of people that probably were not surveyed that may actually represent a higher percentage of the patient population. And specifically for glaucoma, however, that percentage is somewhere along the lines of 5.5%. So what are the types of complementary and alternative therapies that have been reported? Well, I'm going to specifically focus my talk on herbal remedies, acupuncture, exercise, and diet. And I understand that some of these may actually overlap with something that you've heard earlier, but I guess I'll go into a little bit more detail about it. The other three that I listed on there, I'm not going to go into too much detail about because there's just not very much evidence to support their claims. Chiropractic medicine, for example, they've done a couple of studies on it, and they just really have not found any benefit in using chiropractic medicine for the purpose of treating glaucoma. When it comes to meditation, they've done a study looking at stress specifically and found that stress itself never really increased the intraocular pressure, and conversely, when they relaxed the person using meditation therapy, that also did not lead to a change in the intraocular pressure either. And megavitamin therapy, I'm pretty certain that if you've ever gone to any sort of store like Costco, GNC, anything like that, you found probably multiple types of vitamins that make claims about improving eye health by using them. Well, in reality, looking at all the different studies on the different vitamins out there, not a single one of those vitamins have ever been shown to be beneficial in improving glaucoma when taken in high doses. So what about exercise? Well, there was actually one study that found that when you work out pretty heavily for about half an hour at a time, this is once again cardiovascular exercise, there was an acute lowering of the intraocular pressure that lasts about an hour after exercise, and it was actually a pretty significant drop that was approximately 20%. However, it was a short duration of action that this lasted. On the other hand, when people consistently exercise for approximately 3 months, once again, a heavy exercise, there was a consistent drop in the intraocular pressure by about 1 to 2 millimeters of mercury. However, this is kind of controversial because other studies have not found the same result. Conversely, however, when you look at sleep apnea and obesity, we know for a fact that this actually does worsen glaucoma. Multiple studies have been published on this fact, and also our own experience has found that when people have sleep apnea, they have significantly worsening of their visual fields, and when that improves, their visual fields also improve too. Now, everything that I've talked about when it comes to exercise, it only applies when you're actually doing strenuous activity, and so if your definition of exercise is anything like this, well, all bets are off. So, what about diet? Well, there was one study that was performed out in UCLA by Dr. Ann Coleman, great doctor, by the way, who basically looked at kind of a population-based study across the board with women who had osteoporosis and looked specifically at whether certain diets reduced the risk of having glaucoma. And what they found is that once a month intake of either collard greens and kale was associated with a lower risk of having glaucoma. Fresh carrots, eating 1 serving a week, was also associated with this reduced risk. And finally, eating dried and canned peaches. Don't ask me why they specifically chose dried and canned peaches. I'm just the messenger. But this is also associated with a lower risk in having glaucoma. This is not to say that these particular foods are associated with a reduced risk of progression in glaucoma, or that it actually causes a lowering in the intraocular pressure. It was just a study where they found that the people who ate these particular foods had a lower risk of having glaucoma. Acupuncture. So there was one study that looked at acupuncture specifically, and they found that there was a mild benefit in glaucoma. It was approximately a 19% reduction in the intraocular pressure amongst a small group of patients who had glaucoma. The disadvantage of this, however, is that this was one study, and that there was, in acupuncture, it's based on kind of Chinese medical diagnoses, and so there's no standardized definition of glaucoma in acupuncture. So what that basically means is that as a result, there is no standardized treatment that's going to fit perfectly for glaucoma, and the way they perform acupuncture for different people may not necessarily have the same effect. And finally, there's a very short duration of action. What they found was that in this study, they did acupuncture on a patient, and then they proceeded to check pressure about 15 minutes after the treatment. And indeed, amongst those patients, they did have a reduction in their pressure, but when they brought them back about 3 days later, that pressure reduction had completely disappeared. So unless you're basically going to be like this fellow up here and have acupuncture every 3 days, there are more efficient ways of getting treated for glaucoma. So what about herbal remedies? I think most of my talk will focus on herbal remedies just because there is so much exposure that people have to these types of alternative therapies. So the first one that you've probably seen a lot of when you go out to the stores is bilberry. The active component in this particular berry that's useful in glaucoma is flavonoid anthocyanosides. And how we think it works, well, we're not entirely certain. We know that it has some sort of antioxidant properties. We believe that it may inhibit clotting of the blood by platelet inhibition, and it may improve blood sugar levels as well. Now, there have been two forms that have been developed. One is an eye drop form, and another is an oral pill that you take by mouth. Does it help? Well, it's really unclear. There was only one study with a small population that found that maybe there was a slight improvement in their visual fields amongst this particular population of low-tension glaucoma patients, but the mechanism is really entirely uncertain, and whether it even applies to glaucoma specifically is also uncertain. They proposed that perhaps it was an improvement in the ocular blood flow to the optic nerve, or there is even a possibility that it's improving the blood flow to the brain and thereby improving your neurological status. And that basically this improvement in your visual fields may actually be because you're able to pay attention a little bit better rather than an actual improvement in your glaucoma status. Now, what are the adverse effects of this particular remedy? Well, it's very mild, but they are there. So the reported effects have been with the systemic intake. There is cases of anemia, there's cases of jaundice, and also some people having muscle wasting. In the case of the ophthalmic eye drop, well, the problem with using an eye drop from these type of companies is that there's no standardized way of producing them. You heard just from the previous talk that when it comes to FDA-regulated medications, there are very strict standards for how these compounds are made and how they have to be formulated so that they meet guidelines. Well, in the case of supplements, there is actually no FDA approval process or regulations, and so as a result, there were actually cases of corneal infection that developed as a result of contamination of the eye drops. The next one I'm going to talk about is ginkgo biloba. You've probably heard this a lot more than the bilberry, just because there's a wide variety of effects that ginkgo have been used for. It comes in an oral pill, and the mechanism of action, they believe, is by improving blood flow. Now, once again, the same study that I had talked about earlier with bilberry also looked at ginkgo biloba as well, and they kind of also found the same thing with it, which is that there was an unclear improvement with the visual fields in low-tension glaucoma patients, and the mechanism, they believe, was possibly because that it improves optic nerve blood flow. Now, what are the problems with using it, however? Well, it's a very low risk, but the risk is there, which is that there's a risk of spontaneous hemorrhage, and that includes sometimes even something as severe as some bleed inside of the eye or even inside of the brain. There is adverse interactions with any blood thinner use. So basically, if anybody is using aspirin, Plavix, Coumadin, Xarelto, anything like that, you probably should not be using this medication or this supplement just because it can interact with it and cause a significantly higher risk of spontaneous bleeding. And also, there's very limited evidence to support its efficacy because it's just like with the bilberry, we don't really know whether or not the improvement in the visual fields in that study were because it was actually improving the status of the optic nerve, or whether it was just improving a patient's ability to focus and concentrate better to do better on the test. Now, what about cannabinoids? This is kind of a hot new topic recently because of its legalization in medical use in Pennsylvania. The active ingredient in it is delta-9 tetrahydrocannabinol, also known as THC. Multiple forms have been created with it, which includes inhaled, oral ingestion, and topical drops. This is probably one of the few of the remedies out there that have not been approved, that have not been regulated by the FDA, where they have actually found in studies to lead to an improvement in the intraocular pressure. The peak action is at about 2 hours after smoking or ingestion. Now, what about some of the other forms? Well, the eye drops, while it was found that it really did not have much in the way of adverse effects on the eye, also found that it didn't work much either. The systemic cannabinoids, on the other hand, have been shown that it does reduce the intraocular pressure by about 20% to 30%, for about 3.5 hours. Now, the problem with this, however, is that the duration of its effect only lasts about 3.5 hours. So in order to actually get a sustained effect with the use of marijuana, you would actually have to be smoking it every 3.5 hours around the clock, which includes overnight. So, I don't know about you, but I don't know of anybody who has ever used this on a recreational basis who have been so diligent about its use as to go about going this. So it basically means that there are easier ways of treating your glaucoma. Also, the psychotropic effects are undesirable or desirable depending on who you ask, but they are limited. They include dizziness, confusion, and sleepiness. And also the other issue with the use of marijuana for glaucoma is that it's uncertain if the effects are additive with other medications. So what are the hazards of using it? Well, I mentioned briefly about the psychotropic effects. What I didn't mention so far yet is that they actually did one study where they looked at patients who had advanced glaucoma, who were just willing to give anything a try, and they enrolled a small group of them to basically use around-the-clock cannabinol therapy. Well, I think amongst this group, 60 to 70% of them actually dropped out of the study because after a while they just could not tolerate the side effects. And so that kind of gives you an idea of how severe it is and how undesirable it is to use this around the clock like that. There is a possibility that it may reduce ocular blood flow, and which may not be good for the optic nerve in glaucoma. It increases the heart rate, and it does actually cause lung disease. Now, the lung disease that, there's kind of this misconception that people say that cigarette smoke is more harmful than marijuana use. Well, it's actually the direct opposite. There are actually higher concentrations of cancer-causing agents, TARs, and volatile chemicals that are in much higher concentration in the use of marijuana compared to cigarette smoke. And finally, there's no standardized plant material. So just because one strain of marijuana may be effective in lowering the pressure by 30%, it doesn't mean that the next strain that you get from a dispensary is necessarily going to have the same effect. Now, what about cost? Well, we all hear about how, none of us want to pay more than $50 for an eye drop. Well, when it comes to the use of marijuana, what they've actually found was that in one study, when you use it around the clock, the estimated cost per month is anywhere from $690 to over $8,000 per month. It's not covered by medical insurance, and so what it means is that there are cheaper ways to manage your glaucoma. And also, finally, tolerance. The longer you use the medication, there is a possibility that you can develop tolerance to it, and which can include less lowering of your intraocular pressure. So in conclusion, healthy diet and exercise may be helpful. It certainly cannot hurt. There is no complementary and alternative therapy that have been truly proven to be effective. take your prescribed medication, because these are the medications that have been through vigorous studies, as my previous speaker had basically alluded to, because they work and they have been shown to work. And finally, alternative therapies, while they may or may not work, many of them may have unpredictable adverse results, adverse events that may be unaccounted for and may interact with other medications. So,